Are you a medical student curious about the USMLE? If you're interested in becoming a practicing medical professional, then keep watching this video for everything you need to know about the USMLE. Hey guys, welcome back. My name is Dr. Ava, and I'm an internal medicine hospitalist. I am here to help medical students to explore the information surrounding these exams. I offer students my personal experiences and mentor medical students who might be unsure of what to expect from a career in medicine. It's incredibly rewarding to share my knowledge with students to help them achieve their dreams of becoming medical professionals. My goal is to share my personal knowledge about the USMLE. The USMLE represents the United States Medical Licensing Examination. This assessment is divided into 3 steps and determines the student's ability to apply key concepts of basic sciences involved with practicing medicine. Unlike other knowledge-based exams, the USMLE thoroughly emphasizes on how well you can apply your skills, your values, and attitudes to real-life patient-centered scenarios. To apply for USMLE examinations, you must submit an application through the appropriate registration entity. There are 3 steps to it. Step 1 is usually taken in your first 2 years of medical school. The USMLE Step 1 is a 1-day computer exam taken by most medical students at the end of their 2nd year of medical school. It is also taken by thousands of international medical graduates, also known as IMGs, who wish to practice medicine in the United States. The Step 1 includes no more than 280 multiple choice questions and spans 8 hours of testing, broken down into 7 one-hour blocks of 40 questions each. It emphasizes basic science principles, specifically anatomy, behavioral science, biochemistry, microbiology, pathology, pharmacology, and even physiology. Interdisciplinary areas such as genetics, immunology, and nutrition are also tested. So let's learn more about the test. The test is administered by appointment on a year-round basis. When planning your USMLE prep, factor in 6 to 9 months for Step 1 review. Most Step 1 scores are reported within 3 to 4 weeks of testing, and the recurrent fee in 2021 was $645. Before, there was Step 2 CS and Step 2 CK, which were both taken in the 4th year of medical school. USMLE Step 2 CK evaluates the applicant's ability to apply medical knowledge, skills, and understanding of clinical science crucial for patient care, while the USMLE Step 2 CS tested the applicant's ability to gather information from patients and perform physical examinations using various tools. However, on hold since May 2020, the Step 2 Clinical Skills, the CS exam, a portion of the USMLE was canceled permanently. The National Board of Medical Examiners, the NBME, and the Federation of State Medical Boards, the FSMB, the organizations that oversee the USMLE program, announced the exam's cancellation in late January of this year. Now, Step 2 CK is the only Step 2 which ensures that due attention is devoted to principles of clinical sciences and basic patient-centered skills that provide the foundation for the safe and competent practice of medicine under supervision. Step 2 CK is a 1-day exam. It is divided into 8 60-minute blocks and administered in 1 9-hour testing session. The number of questions per block on a given examination will vary, but will not exceed 40. The total number of items on the overall exam will not exceed 318. The exam also includes a minimum allotment of 45 minutes of break time and 1 15-minute optional tutorial. The fee for this portion of the test is the same as Step 1, which is about $645 in 2021. Once you get accepted into a residency program, residents must pass step 3 of the USMLE, which is the final exam in the USMLE sequence leading to a license to practice medicine in the US without supervision. Step 3 provides a final assessment of physicians assuming independent responsibility for delivering general medical care. In 2021, its fee was about $895. It is important to note that the USMLE program is changing the limit on the total number of times an examinee may take the same step or step component. After this policy is implemented, an examinee will be ineligible to take a step or step component if the examinee has made 4 or more prior attempts on that step or step component, including incomplete attempts. This policy change will reduce the total number of attempts an examinee may take per step or step component from 6 to 4. The new policy will be implemented no earlier than July 1st, 2021. The scoring system has also some changes reported. On February 12, 2020, the USMLE program announced it would change Step 1 score reporting to a pass-fail outcome only for administrations on or after January 26, 2022. Outcomes for Step 1 administrations occurring before January 26, 2022 will continue to include a 3-digit score and pass-fail. Step 2 clinical knowledge and Step 3 exams will continue to be reported as 3-digit scores and pass-fail. It's very important that examinees read the information provided by the United States Medical Licensing Examination, the official USMLE website, for constant updates. Now let's talk about preparing for these tests. In order to be prepared for the USMLE, students must begin studying well in advance to avoid last-minute cramming sessions, which are often not as effective as long-term study plan. A variety of questions will be asked in a variety of different ways. There are multiple choice answers following data and charts, images, and relevant information to medical terms, diseases, various patient scenarios, and best practices. Before taking the exam, study and practice with simple tests so that you can become comfortable with the style of questions on the exam. Tutorials are also available to assist students with the USMLE. Read each question very, very carefully. Understanding what the question is asking is vital in order to correctly answer the question. After reading and understanding the question, formulate your own response before even looking at the answer choices. Be sure to read the answers thoroughly and choose the best option. Now, if you don't know the answer, make an educated guess. Do not ever leave any unanswered questions, if at all possible, because no response is considered an incorrect response. The goal of all these tests is to establish a clear understanding of the materials studied in medical school and during clinicals before officially practicing medicine. When it comes to saving people's lives, medical professionals have an incredibly important role to play. Validating medical students' knowledge about how to handle various medical situations is imperative for future patients' best interest. The questions and responses of the USMLE are reviewed by 2 professional committees of medical educators and clinicians. Consistent revisions of this particular exam are critical to avoid any outdated materials and stay up to date with the constantly evolving medical practices. Now put on those mental scrubs and show them what you're made of. If you want something more personalized for you in a chronological and organized way with my one-on-one support, I have an online mentorship, Live With Me, you and I together for an hour, with me teaching you step by step on how you can successfully get into medical school or how you can successfully pass the USMLE. Click on the link below to learn more. Thanks for watching. See you next time.